Go.
Hi, my name is Naomi Trinidad-Kudra, and I'm a registered nurse in the Winston-Salem State RN-BSN nursing program. And this evening, I'm going to do a nursing exam, specifically in the in the neck and heart vessels. And my coworker here, Ashley, has agreed to be my patient. And we are going to do some patient teaching and how she can continue to lead a heart healthy lifestyle, and we're going to talk about modifiable, non-modifiable factors in heart disease. I've provided for hand hygiene. I'm going to go meet my patient. We're going to get started. Knock, knock. Hey, Ashley. How are you?
Good.
Good. I'm Naomi. As I said, I'm going to be your nurse. Your doctor wants me to do a mini exam on your neck and heart vessels, okay? But first, I need to get a set of vital signs just to make sure all is well, and I can put that in the chart so that he can be able to see that. Is that okay?
Mm-hmm.
All right. I'm going to have you get up if you can. Be careful. And you can step up when you're ready. Excellent. And carefully get back to bed. Now, I just have a question for you. Have you had any chest pain, shortness of breath, or chest tightness, or notice any swelling? Okay. I'm going to go ahead and do your blood pressure. Any kind of familial history of heart disease?
No.
Or heart attacks, anything like that?
No.
Perfect. All right. I'm going to put this on the arm. And your finger. Alright, Ashley, so while that is starting, I'm going to talk to you a little bit about the heart. So the heart to me is one of the most interesting organs in the body. And so it's divided in, I call, two different chambers. You've got your right pump and your left pump. You've got your upper chambers and you have your lower chambers. So you've got two atria and two ventricles. And so how the heart works, so to speak, you get your old dirty blood. It comes into the right side of the heart and it filters down from the right atrium to the right ventricle. Then that dirty blood gets pumped into the lungs, be cleansed, and then new blood is exchanged. It gets pumped to the left side of the heart, and then it goes down to the left ventricle, into the aorta, into the body to perfuse and feed organs and cells. Easy as pie. But the key to having a heart healthy, or a healthy heart, is to lead a heart healthy lifestyle, so to speak. And so with cardiovascular disease on the rise in our society, we have to educate our patients about it. So today, I'm just going to do a mini assessment on your heart and listen to the sounds of it. Make sure I don't hear any abnormal sounds. Make sure there's no swelling in your body. And continue to make sure you're healthy.
All right.
All right, vital signs look good. Just that way. All right, so real quick before I get started, I want to talk about some modifiable and non-modifiable. So modifiable are things that you can control, how you can keep yourself healthy and keep that heart muscle strong, such as exercise, low saturated fats, which are bad fats, no smoking. Smoking constricts the blood vessels, and so that can elevate your heart, your blood pressure, your heart rate, and can cause stroke, heart attack. So just kind of modifying your lifestyle, so to speak. Things that you don't have any say-so in, so to speak, is your race. It could be your gender, or some people are born with heart defects, so to speak. So there's some things that you have control of and other things that you don't. Okay? So now, do you have any questions thus far? I know I've kind of like blabbered out a lot of stuff.
No.
All right. So what I want to do is I'm going to look at your neck vessels. So first what I'm going to do is lie you flat. Okay?
Okay.
Isn't it fun being the patient?
Mm-hmm.
All right. So what I'm going to do, what I'm looking for, is I'm looking at that vein that runs over that sternocleidomastoid muscle, and it's the jugular vein. So what I'm looking for is I shouldn't see any kind of distension of it. So if I see any distension, I may wonder, is this patient in any kind of heart failure? So I want you to turn your neck that way. And I don't see any bulging. I should see a flat vein. And some people that are lighter, you can see it, but it shouldn't be bulging, so to speak. So looks good. I want you to turn to the other side. Excellent. Okay. Now I'm going to lift you up. And then what I'm going to do is I'm going to touch the your carotid pulses. I'm just going to feel for the strength. Okay. I'm going to take my 2 fingers, hopefully they're not cold. Good strong pulse, 2 plus. Good strong pulses bilaterally, 2 plus. I've noticed the upstroke of the pulse is good, strong. Now what I'm going to do is I'm going to listen to make sure I hear no bruise. So bruise is turbulence. And that could be indicative of coronary artery disease or stenosis of the arteries. So I'm going to take my stethoscope and put it against your neck and listen, okay? Good. I didn't notice any abnormalities, any kind of abnormal sounds, so we're good there. Now what I'm going to do is I'm going to palpate over the precordium, so I shouldn't feel any vibrations over the chest. Okay, so I'm going to take my hand and palpate over your chest, and I shouldn't notice any abnormal feelings. Okay, so no vibrations. And lastly, what I'm going to do is I'm going to listen to your heart, okay? So what I'm going to do, excuse me, there are 4 valves I need to listen over: the aortic, pulmonic, your tricuspid, and your mitral valve, okay? So what I'm listening for is any unusual sounds such as clicks, any kind of murmurs, swooshing noises. I'm listening for S1, S2, which is a closure of your aortic and, your AV valves, and semilunar valves, which gives you a heartbeat. Okay?
Okay.
Okay, I'm going to go right here underneath your, right here. Good. So what I did was, I should have explained before, and I should have palpated for the apical pulse, but her aortic and her pulmonic valves, you can find them between the second intercostal spaces, and then her tricuspid, you can find it, I call it right beside the sternal, what do you call it? Sternal notch, and then your
Xiphoid process?
Or xiphoid process, and then your mitral valve in the mid-clavicular line. So now, I didn't hear any abnormal sounds. I heard the S1, S2, I didn't hear any clicks, I didn't hear any gallops, ventricular or atrial gallops, so no S3s, S4s. So now I'm gonna listen for any murmurs, but I'm gonna use the bell of my stethoscope. Okay. Excellent. And again, I didn't hear any unusual sounds. I have just completed my exam for your provider, and I will give him a report that everything seems well. Do you have any questions right now?
No.
Thank you.
Thank you.
This concludes our exam.